Welcome back. For those of you tuning in, I'm Rachel Ash, and I'm here with my co-host Juhi Singh and our very, very special guest today, Dr. Suzanne Steinbaum, who is now part of the Juhi Ash team. So welcome back, guys.
Thank you.
Thank you.
Thank you. One of the things we were talking about before we cut to the commercial break was symptoms. Men and women presenting the same symptoms, going to an emergency room, being treated totally differently. And I think I'd love for you to talk about that, Suzanne. Like, what are some of the symptoms that women present with when they're having heart issues? What should they look out for? Would you just talk about that?
Sure. So most commonly, the major symptom of having a heart attack is chest pressure, chest discomfort. In women, it might not always be that obvious. It could be shortness of breath, palpitations, as I mentioned earlier, nausea, vomiting, sweating. But what's so scary is it could even be as subtle as flu-like symptoms or having sleep disturbances. Every time I say that, everyone gets so uncomfortable because everyone in New York lives like that all the time. It's like everyone thinks they're having a daily heart attack. But in New York, we might be. I'm not sure. Yeah. But, the reality is, and I say this often, is that no one knows your body better than you do. And one of the reasons I think exercise is so important is not only the obvious benefits, but it's also a really good barometer to see how you're feeling. So if you do the same activity every day and all of a sudden it's really hard for you, really think about your heart. But what's so interesting is I will see women who aren't really sure what's going on, and I see a lot of palpitations. I see shortness of breath. I even see chest discomfort, and they won't come in because they're embarrassed. I hear women say, and there's been studies that show women don't want to call 911 because they're afraid they're going to be wrong. And as I say, when I was in the emergency room, we didn't have a choice. We had to be there. You might as well come in. We're there anyway. Keep us busy. And the worst case scenario is that you don't go and something is wrong. Not that you go and you're fine. That's the best case scenario.
Right. And I think women are also so conditioned to take care of everybody else before themselves that
I don't know what you're talking about.
that they don't want to be vulnerable.
Well,
they don't want to put themselves
absolutely.
out there.
I mean, everyone will say, we're not going to go to the ER. We have to take care of our kids. We have to make dinner. There's 900 million other people to take care of besides yourself. And clearly, and we all know this, but I'm telling you right now, if you don't take care of yourself, everyone's going down.
And it's women of all ages.
Everybody, every woman, all ages. The universality of women is fascinating. It really is interesting. From all walks of life, we're all the same.
Absolutely. And I want to ask you too, Juhi, you guys see a lot of the same patients. And I want just how you handle them holistically also from your perspective.
So when someone comes in to see me, we go through a very in-depth consultation. I want to know what they're eating. I want to know how often they're going to the bathroom. I want to know if they have headaches. I don't care if they're coming in for pain in their ankle. I want to understand the fabric of their being and understand what they respond to and what they don't. And I always say every thought manifests on a cellular level, but oftentimes we can't measure that until something happens. And that is also why it's so great having Dr. Steinbaum in the office because, stress is a huge indicator. And just yesterday, actually, we had a patient and someone who was put on different medications that she had an adverse reaction to. And just being able to run down the hall and have Dr. Steinbaum there and pull her in to be able to meet with the patient, knowing that everything is being handled under one roof. It's succinct, and it's the synergistic effect that is so powerful. And when you combine it together, when you look at it from the Eastern side and handling stressors and stress factors that can impact everybody's daily life. We're living in New York City or wherever you are in the world, and knowing that it's manifesting on a very deep level, but we can't often tell what that is again until something happens. But having Suzanne in the office and knowing that there's a partner, there's a person that I can go to that I trust implicitly, that has the best instincts, it's fantastic.
So this really truly is the 1 + 1 = 10, or so the 1 + 1 = 1,000 in
1,000.
this scenario. Because as a patient, can you imagine going into a place where, I mean, you never really hear of cardiologists talking to doctors and to other doctors and just physicians being able to coordinate and communicate in a way that's effective and helpful for the patients. That doesn't happen very often. And the way that you two practice and work together, it's really incredible. So as we were talking about symptoms before, when somebody's coming in and presenting with symptoms, you both can really put your heads together and figure out what's going on.
Well, yes. Yesterday I had a patient who was complaining of palpitations, tachycardia, racing heart, and I looked through her meds and I felt something was very off, and immediately ran to Suzanne and pulled her into the room, and we're getting this woman back on her feet really quickly.
Oh, and it's going to be really quickly. And she's been sick since November.
Wow.
Yeah.
I mean, her resting heart rate went up 20 beats.
Wow.
Per minute, which is, I mean, it's very scary. But again, knowing that you have everybody under one roof is, I can't tell you how powerful that is, because no one is doctor shopping anymore.
I'm going to tell you what I think is really interesting.
Tell me.
I think it's fascinating, and we see this. I see this,
Mm-hmm.
that, and let's just talk about the women patients for a second.
Absolutely.
That they'll say they don't feel well, they're going to go to an acupuncturist.
Mm-hmm.
And I'm like, did you think, like, maybe you should have called me?
Maybe.
So, and I understand it personally. Like, I feel tired. I'm so exhausted. I'm just not myself. I just need a little pick-me-up.
Mm-hmm.
I'm going to go get acupuncture. And I hear that thought process. And it's kind of interesting because here they are in the office. They didn't really know they were going to end up in a cardiologist's office after that. And it's not all the time. You know, that's not really what we're doing. But what's so fascinating is because symptoms are so esoteric in women, that they're there for you, and maybe they need to be there for me too.
100%. I mean, this happened
absolutely.
again. This just happened yesterday. We know in our hearts, pun intended, that our goal is to change the face of medicine, how medicine is practiced, how patients are being taken care of, and it is vital to understand what they're going through, what our patients are going through, and to figure it out at such a basic, fundamental level. And as Suzanne said, to empower our patients. We don't want people to be dependent on us. We want to teach them. We want to educate them. We want to give them tools so that when they walk out of that office, they know what they can do, whether it's exercise, diet. But we're looking at the entire picture. It's all encompassing. It's not just one facet. And I think that is so important to hone in on.
Absolutely. And Suzanne, you said something really interesting without even really saying it, but you said, women, when you know your body is changed, when you know something's happening that's not normal, listen to your intuition.
Yeah.
And I think that's such a key. Women are so intuitive, but just to really be able to understand your body, understand that something is different, and then having a physician like yourself who actually listens and understands that even something so subtle is a message, and to listen to that message.
Absolutely. I did this little study on my patients, some that had heart issues, and went through something with their heart. And I would ask them, did you know it was your heart? Really, did you know? And they might have not gone to a doctor. They might have pushed it off. But I will tell you, 99% of them said they knew it was their hearts. So now I ask first, do you think it's your heart? Do you really think it's your heart? And sometimes they'll say yes. Sometimes they'll say no. Sometimes they'll say they're too scared to know. But I have to tell you, shifting this paradigm isn't waiting until something happens. And after doing this for 20 years and doing that preventive cardiology fellowship and spending years learning and really, I have to say, some of it reaching out outside of the system, going to different experts in different fields, lipidology fields, and really reaching out to educate myself on things that I'm going to say have not been considered part of the guidelines. Doesn't make them less valid. There's studies that are done, multiple trials, but they're not yet in the guidelines. It takes about 20 years for research to hit clinical practice. Guidelines are about clinical practice. So what happens in those 20 years if you don't really read and study and research? You don't learn, you don't grow, you're not able to offer what's really, really out there for patients. So I created this sort of method of looking for early disease in women's hearts based on physiology, their functional status, their anatomy, their metabolism, their genetics, and really creating sort of a picture of who they are, where their hearts are at, where their arteries are, and giving them a personalized, unique lifestyle program based on diet and exercise. There are fascinating blood tests out there that we can talk about a little more that really get to show us the 5-year risk of heart disease based on inflammatory markers. This exists.
So as a patient coming in to see you, somebody gets all of this information.
Yes, absolutely.
It's a roadmap to your heart health, essentially.
I call it boot camp, but you
Boot
call
camp.
it whatever you want.
Roadmap seems easier. But either way, I'll take it. It's all getting to the root of what's going on.
Exactly. But it's really personalized to you. And it's not just go on a diet and exercise. This is the food you need to eat for your metabolism, for your genetics, for your makeup. And this is how you exercise. And I actually create an exercise prescription.
Amazing. So for more information on Dr. Suzanne Steinbaum, on Juhi Singh, on the Juhi Ash Center, you can go online at www.juhiashcenter.com. That's JUHIASH center.com, or you can call the office at 212-758-3200. That's 212-758-3200, and we'll be right back right after this.